Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Hypoxia and its types. So the first variety we will see is the hypoxic. So under hypoxic, what is the etiology? So here the etiology is it is decreased in the PaO2. And what are the examples here? The examples, it includes the very high altitude. So high in altitude as well as in terms of the lung diseases. So how is the PaO2? The PaO2 here will be decreased and the dissolved O2 content. So the dissolvement of the O2 will also decrease. Then what about the O2 that is combined with the Hb? So this will also decrease. Then when you ask about the chemoreceptor stimulation, so chemoreceptor stimulation will be positive and the amount of reduced hemoglobin. So the amount of the reduced hemoglobin, this will increase. Lastly, what about the cyanosis? The cyanosis will be present. It is present. So this was about the hypoxic. Now let's look at the anemic. So here in terms of anemic, this etiology, that is a cause, it is decreased in the available hemoglobin. It's decreased in the available Hb. And the example here will be the anemia. So the example is anemia as well as the carbon monoxide poisoning. So how is the PaO2 and the dissolved PaO2? So PaO2 as well as the dissolved O2 content. So both of them will be normal. And what about the oxygen, which is combined with the Hb? So the oxygen combined with Hb will decrease in terms of the anemic. Next, let's look at the chemoreceptor stimulation. So under the chemoreceptor stimulation, it is not stimulated. This is not stimulated. And what about the amount of the reduced Hb? The amount of the reduced Hb, this will, in this we need to know that the total Hb will decrease, whereas the HHB, this will increase. And what about cyanosis? Cyanosis, it is unlikely with present, so it is not mainly present. Next we move on to the stagnant variety. So here in terms of stagnant variety, the etiology, the cause is that the oxygen carrying capacity is normal. So the O2 capacity, if you see, this is going to be normal, but the oxygen delivery is decreased. The oxygen delivery is decreased. Now let's look at some examples. So examples here is presence of heart failure, shock and hemorrhage. So there is heart failure, there is presence of shock as well as there is presence of the hemorrhage. Next, what about the PaO2? The dissolved oxygen content as well as the oxygen combined with the Hb. So the answer to all this is that it is normal. Now, in terms of stagnant, the very significant finding is here in the chemoreceptor stimulation, this is very positive, and the amount which is decreased in the Hb, this is also very much increased. Next, cyanosis, it is similar to that of hypoxic, that is, it can be present. Lastly, we'll look at the variety that is histotoxic. So here in histotoxic, the first category is the etiology. So under etiology, it is there is no oxygen utilization. So there is no oxygen utilization at the tissue level. So at the tissue level, there is no oxygen utilization. So there is no oxygen utilization. And then what about the examples? Let's recap the examples. In hypoxic, it was high altitude and lung diseases. In anemic, it was anemia and carbon monoxide poisoning. In terms of stagnant, it was the heart failure, shock as well as the hemorrhage. And in histotoxic, it is going to be the cyanide poisoning. Now let's look at the PaO2. It is similar, that is the PaO2 as well as the dissolved oxygen and the oxygen which is combined to Hb. So the answer to all this is that it is normal. And looking at the chemoreceptor stimulation. So chemoreceptor stimulation is highly positive, and the amount of reduced hemoglobin, the amount of the reduced in the hemoglobin. So the reduce in the hemoglobin will be decreased here. And what about cyanosis? The cyanosis will be, it is unlikely, which is present here. To learn and grow daily like this, please do subscribe.